he's in control of his hips, has control. Right at this point, then he loses control of what is good movement and what is bad movement. So when we're thinking about that foot, just think equal weight distribution. Can we maintain the integrity of the arch of the foot? Okay, and is that heel coming off the ground? When it comes to the ankles, think, do we have that 15 to 20 degree of movement? And are we able to get to that 90 degrees while maintaining an upright torso? Okay, if those two things are not in sync or correct or where we need them to be, that's your point of focus. That's what you focus on in the warm-up, and then you've got to select exercises that allow for limited mechanics of the foot or ankle mobility, such as wall sits or whatnot, where we can load them up and get some load through them. Let's say those two things are good. We've got to check our knees. Are our knees tracking in the right direction? Okay, so and is there excessive tracking? If they're not tracking in the right direction and we're getting some valgus knee or there's excessive tracking, it is not a knee issue. 9 times out of 10 is not a knee issue. It is a hip issue, okay? So focus on firing up that big stabilizer in the hip and you'll guess the knee will correct itself. And then when it comes to squatting, the most important thing that we need to understand is there a butt wink happening? Do we lose control of the hip when we go to that 90 degree or anywhere on the way down to that 90 degree level in the squat, okay? If we do, we've got to focus on, first and foremost, making sure our core and hip stability is correct with some of our exercises that we did yesterday, our core stabilization and our pillar prep exercises. And second of all, then we just got to make sure that these stabilizers, our lumbar spine and our hip, are working well through our reverse hypers, our RDLs, anything that fires and attacks that posterior chain to help our hips move correctly. Yeah.